Hi, welcome to another one of our Dr. Foot videos. Just about to start a very busy clinical day today. Thought I'll make a short video. First of all, thank you for all the feedback that we've had on YouTube, Facebook, Twitter, as well as Instagram about our videos. It's really appreciated and gives me a lot of encouragement to do more. I've had feedback as far as San Francisco for somebody who's seen one of our videos and has passed it on to one of her friends, which is really good, which is why we do what we do. We genuinely want to help people. Just like a DJ takes requests, I'm taking a request for a video now. Now I've had a request from one of our patients who says, can you make a video about bunions? No, okay, we'll try. First of all, it's important to understand what a bunion is. Bunion is a condition of the big toe, where the big toe moves towards the lesser toes. It's called hallux abductor valgus. The big toe moves towards the lesser toes and you get a bunion joint here. So you get an angle that gets created from the first metatarsal joint. It can be very painful at the bunion joint, but also causes problems in the second toe where it causes it to hammer. It can be quite painful. You can also get corns and calluses under the ball of the foot, which are also very painful. But it's generally the bunion joint which sits on the outside of the foot, which is very, very painful. It's often caused because of poor fitting footwear. So ladies that wear really high heel shoes, that is putting a lot of pressure on this first metatarsal joint. That's one of the reasons. Also tight fitting footwear. If the footwear is pressing down on the big toe and the little toe, this causes that compression. Other causes include rheumatoid arthritis and gout. Sometimes a patient can have too much movement in the foot, so it's hypermobile. These patients also tend to be quite hypermobile everywhere else, so their knees tend to be quite hypermobile, hips, wrists, fingers. These patients also tend to develop bunions. Prevention is always better than cure, so I always recommend an early intervention. Often just changing the footwear can make a massive difference. What I would say is there are a few different treatments on the market for bunions. Now we have a bunion night splint. I give this to patients. Sometimes you can buy them online, just Google Dr. Foot. We also have a bunion day splint. Some patients wear this during the day, with this at night. They also have these yoga toes, which are used to separate the toes. Can be helpful. And then there's a toe separator which goes in between the first and the second toe, like this. How useful are these products? Well, it really depends. How much flexibility does the patient have in the foot? How pliable are the muscles and ligaments? What's the age of the patient? What is the other contributing factors? What stage is the deformity at? I don't recommend these products to every patient, but I will give them to some patients. It very much depends upon what we see in clinic. What I am a big advocate of is treating the underlying cause. So if the underlying cause is footwear, we try and address that. If the underlying cause is a biomechanical problem where there is later mid-stance pronation, which basically means that when the entire foot is on the floor, it's rolling in a bit too much and putting in a bit too much pressure on this first metatarsophalangeal joint, then insoles are very helpful. So insoles support that foot and prevent that foot from rolling in. There's two main types of orthotics. So you can get a custom-made carbon fiber orthotic, which I do give to some patients. Depends on what we find. This is a Dr. Foot Pro insole. It's one that I created myself, but I need to talk about all the products that I've invented at some stage in my life. This is a comfortable EVA orthotic, so it's not as rigid as the carbon fiber orthotic. However, they can also be effective. It really depends upon the age of the patient and what kind of biomechanical problem I find in clinic. If conservative treatments do not work, then we can always send them to surgery. Now, surgery has improved so much over the last couple of decades. In Birmingham, we've got John Malik. Around the UK, we've got some really good podiatric surgeons. Trevor Pryor, Ian Riley. These are really good podiatric surgeons, and I would recommend a podiatric surgeon over an orthopedic surgeon, mainly because orthopedic surgeons tend to do hips, knees, a lot of knees, and occasionally a foot. Podiatric surgeons, all they ever do are feet, and they get very, very good at it. So a surgical intervention can work and may be necessary. It really depends upon the patient. It depends on if the bunions are affecting their daily lifestyle, if they cannot play a sport like tennis or golf, or just walking with their children or with their husband, or if they're finding that is affecting their daily lifestyle, then surgery may be an option. Now, I've been talking a lot about women's footwear and affecting women. It can also affect men. I have seen men with bunions, and it's not generally because of high heels, unless you're doing something on the weekends that I need to know about, but it's not generally due to high heels. It tends to be because of an underlying biomechanical problem, which is why it's really important to visit a podiatrist. Get yourself checked out. Don't just get your feet checked out, get your entire kinetic chain checked out. So look at your hips, look at your knees. What's driving those forces into that big toe? Is it something that's happening further up at the hips? So these are really important factors to take into consideration. Hope you find this video interesting. I'm gonna finish off my coffee and get ready for my first patient of the day. Take care.